with so many issues facing Congress, from health care reform to unemployment and new questions about how Congress does business, I sat down with the Speaker of the House, Nancy Pelosi. Madam Speaker, welcome back again to This Week. Let's talk health care.
Thank you.
The President said after the summit, we cannot have another year of debate on this issue. We need decisions now. You said on Friday, we are determined to pass health care. Do you have the 217 votes necessary to pass it?
Right now we're working on the policy. The President put I think a good proposal on the internet on Sunday. We're examining that very carefully to make sure it has all the affordability we need for the middle class, all the accountability for the insurance industry, and the accessibility that we need to have. From the meeting on Thursday, the summit meeting, I believe that we're ready for the next step, which is to write legislative language and then go from there.
So what are the fixes the Senate needs to make, in your opinion, through reconciliation, presumably, before the House can vote on it?
Well, I believe, listening to the President yesterday, he's still hopeful that there's a way to have a bipartisan bill. But whatever route the Senate takes, we would like to see, again, more affordability for the middle class. This is very, very important. This is a bill about the middle class, their access to health care, and the affordability that makes that access possible. Secondly, we want to close the donut hole for seniors. This is really an important mistake that was made when the Republicans passed the prescription drug bill, and we want the seniors to have the comfort of knowing that in this bill the donut hole will be paid. I mean, it's a technical a slang term for something that means the seniors pay more.
But if you get that,
the seniors pay more, and we have more. We want to eliminate the Nebraska fix and have equity for all of the states, and that in terms of some of the investments. There are more, but those are three of the main ones. But one of the biggest differences is how the bill would be paid for. We cut waste, fraud, and abuse over $500 billion in the bill, but we still needed more of a pay for. The Senate bill had a tax that we did not like in the House, and I think the President's proposal addresses that concern. So now it's a question of, when you go down to legislative language, you need the clarity, and that's when you find out what everything means.
But you know that the polls show that the American people are deeply divided on health care. Many of them are opposed to it, even though they are supporting certain specific pieces of it. What do you say to your members when it does come to the House to vote on this, who are in real fear of losing their seats in November if they support you now?
Well, first of all, our members, every one of them, wants health care. I think everybody wants affordable health care for all Americans. They know that this will take courage. It took courage to pass Social Security, it took courage to pass Medicare, and many of the same forces that were at work decades ago are at work again against this bill. But the American people need it. Why are we here? We're not here just to self-perpetuate our service in Congress. We're here to do the job for the American people, to get them results that gives them not only health security, but economic security, because the health issue is an economic issue for America's families.
Do you wish, though, that the President had posted his bill before this week, that 6 months ago it might have been more helpful for you, that maybe 6 months ago you knew that the public option was something he was willing to drop before you fought so hard for it?
Well, we still fight for what the public option will do. Whether it's in the bill or not, its purpose must be recognized, and that is to keep the insurance companies honest, to keep them accountable, and to increase competition. And I think in the summit on Thursday it became very clear that what the President was proposing was regulation of the insurance companies. Left to their own devices, they have done harm to the American people. They need to be regulated, and that is one of the biggest differences between the Democrats and the Republicans. Another one, for example, is an example of it is ending the denial of coverage to those who have a pre-existing condition. The Democrats have that in their bill. The Republicans do not. But that's a major insurance reform that has to take place.
But would we still be debating this if the President had put his plan out 6 months ago?
I don't know what the value is of trying. The President has tried since 1 year ago, March 5th. We met in Washington, D.C. in a bipartisan way with some of the outside stakeholders to talk about working together to have health care accessible to all Americans. I smile because I remember Senator Kennedy coming into the room and saying, "I'm signing up as a foot soldier in the fight for health care reform." And of course, he was such a tremendous leader. But that was a year ago. Since then, we've had hundreds of hours of meetings and hearings and markups of bills. Well over 100 Republican amendments are in this bill, the House and Senate bills, and what the President put forth. We'll see if some of what was said yesterday, for those who were making constructive contributions, can be accommodated. Whether we get Republican votes or not, the bill definitely has bipartisan provisions in it. But if they have a good idea that works for the American people, whether they're going to vote for the bill or not, we want it in the bill.
How long are you willing to wait for those ideas?
Well, that happened yesterday.
It made it clear that the President seemed to make it clear that time's up.
Time's up, yes. So we really have to go forth because, as I said there, as we sit around this table, this big table in Blair House, every night families sit around their kitchen table, try to figure out their finances, the security of their jobs, the cost of their children's education, how they're going to pay their medical bills, what is the status of their pensions, and they can't wait any longer. If you have, if your family has a pre-existing condition, or if you are denied coverage, or if you have a rescission, if your insurance has been withdrawn just as you're about to need a procedure, you know that it's long overdue. And what's the point of talking about it any longer?
But the point is when it does finally come to vote on it in the House, you're certain that you can muster the 217 votes that you need, even with the differences over abortion language, things. There have been members of the House who voted in favor of it before, who are now saying we can't vote for this bill because of the Senate language on abortion.
Well, let me say, I have this in three, just so you know how we sequence this. First, we zero in on what the policy will be, and that is what we'll be doing following the President's summit yesterday. Secondly, we'll see what the Senate can do. What is the substance? What is the Senate prepared to do? And then we'll go to the third step as to what my members will vote for. But we have a very diverse party, but we all agree that the present system is unsustainable. It's unsustainable and unaffordable for families, and individuals, for businesses, large, small, and moderate-sized businesses. It's unsustainable to our budget. We cannot afford the rising cost of health care. As the President has said, health care reform is entitlement reform, and it's unsustainable for our economy. We want to be competitive. This health care costs are a competitiveness issue. They diminish the opportunities for our businesses domestically and internationally to compete without this anvil of health care costs.